Hi guys, we are back with a new season or a new episode of my podcast. And today I have Alex with me. She's a women's health physio. And yeah, just hi Alex. If you say a few sentences about yourself, so everyone knows what you're up to.
Yes, I'm Alexandra Schäfer. I'm a physiotherapist, pelvic health physiotherapist. I used to work in Australia for the past, I'm here now for a year and a half. And before that, I was in Australia for 13 years, where I specialized in women's health or pelvic health. And so I see lots of women with pelvic floor issues, some men with pelvic floor issues and incontinence. And that's what I'm trying to do now in Germany as well.
Yeah, and I'm so excited to have finally someone in my corner of the country because I studied women's health in England and there's a lot of women's health physio. So I had a close relationship with the women's health physio as well. So people came to me and I couldn't help them because I'm not a physiotherapist. I could refer them on, and I'm so happy to have you close by now that this is actually possible again and I can refer people to you if I'm at a point where I'm just out of my scope of practice. So it's awesome that you're close by and that we can work together or share clients.
Definitely.
So
yes.
What we wanted to talk about today is what's actually happening to our bodies when we're pregnant or during labor. Like what, just real quick, obviously everyone knows the belly's growing, but what does it mean for our muscles or our tissues or what's happening there?
Yep, a lot. So I've got my pelvis with me. So just quickly, the pelvic floor muscles are right at the base of your pelvis, supporting your organs. We've got basically two layers, superficial layer and deep layer, and they work together to support our organs, to keep us continent. They work with our deep abdominal muscles, with our diaphragm, the breathing muscle. And while a baby grows inside our belly, of course, there's a lot more weight pushing down onto our pelvic floors. And the pelvic floor has to work much harder to keep everything in place, to keep us continent, because there is more intra-abdominal pressure with more stuff inside our bellies. So we do need a strong pelvic floor. And if women have a weak pelvic floor before they start or have some dysfunction, they will often experience some symptoms while they're pregnancy already, like incontinence, which is very typical, or probably start feeling some heaviness because the organs start moving down further. As the baby keeps growing, the fascia, so the connective tissue around the organs and also the ligaments holding the organs in place, they get stretched a lot. So that's a uterus and a vagina. And you can imagine if this is growing to a baby size, all these structures have to stretch a lot. That's only during pregnancy. So, of course, during pregnancy, we have all our hormones helping us, so everything can actually stretch. But yes, that leads to changes already there. And then when we go into labor and the baby is getting pushed out through the vagina and then through our pelvic floor muscles, they become very stretched as well. So up to 200% of their normal length. No other muscle in our body is ever doing something like that. So that will lead to a muscle that will not just snap back. It will just, stay in a weaker, more lengthened position after birth. And sometimes a birth can lead to birth injury, so to tears in the vagina, in the superficial pelvic floor muscles, like perineal tears. Sometimes it can be more severe. Sometimes these deeper muscles can also tear, which is called a levator ani avulsion or tear on the deep muscle. And all these injuries can lead to problems after birth as well. So yes, you go from usually a fairly strong pelvic floor, no stretched tissues inside, to stretched tissues inside and after natural birth to a very stretched and lengthened pelvic floor, and probably some birth injuries on top of that.
That's pretty crazy when you think about 200 times size, like, or it's, what it has to stretch. Like that kind of explains or gets to my next question, like why is it so important to do postnatal recovery like afterwards, like even if you feel fine? Because like a lot of times women be like, oh, I don't feel anything, I don't need that, and then they come once they experience something, but there's so much you can do straight away, right, to avoid getting issues if you don't have any yet, or do something about it if you have experienced issues during pregnancy already.
Well, after birth, I mean, most women, I guess, do feel something has changed. You know, something's more flexible. Something, if you stand for a long time, sort of feels dropping down, maybe. Mm-hmm. But you're right. Some women don't feel that and feel brilliant and start doing, you know, that normal housework, lifting babies, lifting prams. And mums have to be strong, but straight after birth, often the pelvic floor, or usually the pelvic floor, is not able to do all these things. And if we compare it to an injury, so if we have an injury in sport and we overstretch muscles or we tear muscles, or, you know, like anything like that, it's sort of clear that we will have to take a break to heal, to allow the tissue to, you know, go through those stages of healing to be strong at the end again. And then if we haven't done our training or, you know, the things that we normally would have done during that healing time, we would expect that muscle to need some rehabilitation. So some time to get back to what we used to do. And birth is a massive example for that. We don't experience, again, something like that in our body anywhere else. After birth, on top of all the changes that have happened, we usually still have lots of the hormones that keep our tissues soft. So while we're breastfeeding, we can't just get back to normal because the tissues will still be under influence of hormones, keeping everything soft, which sort of makes sense. But yes, so we're not meant to go back to high impact soon after birth.
Yeah. And it's like just training those muscles also help them recoil, right? So like what's so far stretched, like trying to, because I experienced with a lot of clients too that they have a hard time feeling their muscles again. So like getting them back to reconnect to their muscles as well, to be even able to feel what's going on and to be able to engage muscles again and to like learn. It's kind of like disconnected from the brain. It seems like not broken, but sometimes like they seem like have a hard time. Yeah. Because
of course the nerves innervating the pelvic floor muscles, they run along the pelvic floor and they become stretched as well. So they usually don't get damaged permanently. Usually that returns. But often, I mean, anywhere in our body, the message that we should contract or should relax a muscle, that comes from our nerves. So if that nerve doesn't work properly anymore, it's the same as a weak muscle. So we don't, the result is exactly the same. So yes, it's not just muscle and connective tissue, it's nerves as well that usually are involved. So the first 6 weeks after birth, and it doesn't really matter. I mean, I did speak now a lot about natural birth or vaginal birth, where you get this big stretch of your pelvic floor muscles. But if you have cesarean birth, you still had this stretch of the connective tissue, of the ligaments. You still had this pressure pushing down onto your pelvic floor. And on top of that, you also have a scar that goes really deep. That's not just in the skin. It goes through the muscles, it goes through the fascias, and it goes through the uterus as well. So that needs healing too. That's very important. Yes. So if some people think, oh, well, I had nothing happened to my pelvic floor, I can just go back to whatever. That's not quite right, because it still takes time. The pelvic floor will probably recover quicker, but we're not just the pelvic floor.
Yeah, it's connected. So how do I know even if my pelvic floor, if I'm doing my pelvic floor exercise correctly? Like how, because this is a muscle, obviously you can't just touch or it's harder to notice where is it. It's like, I know there's some ways, but like how can people check, or what can they do, or what can you offer them to find out if their muscle came correctly?
It's hard. It's really hard. It's not like our biceps. We can actually look at it's sort of, a movement we're familiar with. Bend your elbow. Well, it's hard here. I guess doing exercises before birth is a very good idea. So even before pregnancy would be brilliant. But of course, not many women think about their pelvic floor before they even get pregnant. But you do have it's easier when there is no extra pressure or if there haven't been a stretch before. So, and then if you've done pelvic floor exercises before, you sort of know what to do, even if you sort of disconnected, even if the feeling is not the same. So tensing your pelvic floor, it's like stopping urine midstream or stopping wind from coming out. It's a tensing around the openings and a lift. But of course, you can't see it. So how can you tell? Well, the pelvic floor works with your deep abdominal muscles, so the transverse abdominis. If you put your fingers just above your pubic hairline and you tense, so you do that tensing of your pelvic floor, you think is tensing of your pelvic floors. Trying to relax first. Doing the tensing, you should feel a gentle drawing in through that, suprapubic area. Some women might not get that, but those two muscles are connected. So you might feel that gives you some feedback on what you're doing. You can't normally activate your transverse abdominis in isolation, but then you do have muscles on top of your transverse. So you've got your obliques and your rectus abdominis. So I guess if you're not quite sure what you're feeling for, you might be cheating on yourself, tensing some other abdominal muscles that you could in isolation to pelvic floor and feel like, oh yeah, I do pelvic floor, and you're actually tensing your tummy. So this could be a way to connect to your pelvic floor and get some feedback, but you have to know what to do. So, talking to someone who knows about it, or probably get someone to actually feel this for you, could be a good idea. Feeling your pelvic floor, you could also use your hand, putting it around the vagina, so behind the vagina, around the perineal area, when you're on your back, or even when you sit on your hand, and then tense your pelvic floor. And you should feel a drawing in and upward movement. It's very gentle, it's subtle. So it's not like a big movement like you would do with your elbow. But some women, and particularly after birth, are quite disconnected, even not after birth. I see that a lot. And as they're trying to do that activation of their pelvic floors, they're actually pushing down. So, and that's something that will be leading to a weaker pelvic floor over time and damage, and could lead to pelvic organ prolapse. So if you do feel, if you've got your fingers on your tummy and your tummy starts to push out, or if you've got your fingers on your perineum and you feel sort of something pushing against the chair or against your hand, have to stop and find someone to help you doing it correctly. Because again, lots of women actually think they're doing it well, but they don't. And then you're better off not doing anything, because it can actually do the opposite.
Yeah. Then find someone who can help you along, right? To reconnect to your body. And it's nothing to be ashamed of either. It's just really okay. It was you go, as you said before, with knee injury or an elbow injury, you would go to the doctor and ask for help, right? So it's the same with the pelvic floor. It's there's nothing to be ashamed of. I think it's also hard because a lot of people make jokes about, for example, leaking after they had kids, and it seems so normal. So they'll be like, oh, well, I had a kid, I just have to get along with it. Or even some are unfortunately told that by their doctors. They'll be like, well, you had a kid, but you just have to live with it. Yeah. But to be aware that there's actually a lot you can do about it, and a lot you can regain your function, and you can get a fully functional pelvic floor and core system again. Absolutely, even after a C-section, after giving multiple births, to actually be able to recover fully. So you also offer pelvic floor checkups. What's that good for, and what do you do during them?
So a pelvic floor checkup is exactly that. So I check pelvic floor muscles. Again, because they aren't so obvious in a place where we can actually see them, it's a vaginal exam. So I do use my finger and I palpate the superficial and deep muscles. I check for strength. So I get people then to squeeze and let go. And that's a way for me to tell how strong are your muscles, how well can they relax, how well can you hold a contraction, how well coordinated. Some people can squeeze really well as long as they hold their breath. And as soon as I tell them, take a breath, everything goes. So it's all about coordination too. It's not just about strength. Yes. So during a pelvic floor check, I can also get an idea if there is any tears on the levator ani. It should. So there is. It's quite. We can usually feel as pelvic floor physios with some experience, feeling for the right thing. We are pretty good at diagnosing tears on the deep pelvic floor muscles, but the only way to for certain to say yes, there is an avulsion is a 3 or 4D ultrasound. But yes, again, usually from my experience, we can actually feel it quite well. And there are some studies comparing an experienced pelvic floor physio to a 3 or 4D ultrasound, and that was actually quite good. So that's things that we can feel during a pelvic floor check. And I do also have ultrasound, only 2D ultrasound, but you can visualize the pelvic organs, you can visualize where the pelvic floor is, and then get people to squeeze and actually see it on a screen, how they change something about the position, which is really good feedback.
Yeah, that's pretty exciting. Like when you actually get to see like what is doing, what am I feeling like.
Yeah, lots of people are like, wow, that's pretty cool. Yeah. So that's I always use that, particularly for postnatal women who feel a bit disconnected, who aren't quite sure. And if I can tell them, well, that's your bladder, that's your vagina, uterus, and now tense, and then they see things sort of lift and pull forward, that's often like a wow. And they sort of feel, I do this and then I can see it changing. So you start connect. So it's a biofeedback. You start connecting those bits again to your brain, basically.
That's super helpful. Yeah. This is like,
so that's
very exciting too.
Pelvic floor check in a nutshell. It's a lot of education, using all my models. So people understand this very complex area. And it's very individual as well. So people come with all sorts of problems. Some have some leakage with coughing, sneezing, or they need to go to the toilet a lot, or they probably have painful intercourse, or, like it always depends on. So first, after a chat, I get an idea what's the problem. I start getting an idea of what I probably will find. And after a check, I know what's going on and I can make a plan. So people can then go home and know what to do. So what exercise to do to improve their problem. But also after birth, what can I actually do? Some women are really keen to start running again after a couple of weeks. And after a pelvic floor check, you can say for certain, well, particularly when you assess in standing, and the pelvic organs probably still drop significantly. I can say for sure, well, you shouldn't start running now. You have to start building your strength first, your coordination. And, it makes sense for them if they see it as well. So they get a bit more time to get some more rehab for their pelvic floor and connective tissues, ligaments, before they go back into high impact. So yeah, that's what a pelvic floor checkup can be for as well. So to guide people when to start what exercise, and then they can come back after whatever time and we can check, how is it now? Is it getting better? Are you now ready to go back to high impact? Or if they have started high impact, we can check after a month or two, has that led to pelvic floor issues now, or pelvic organ drop or something like that?
Yeah, I think that's really helpful too for people. So they'd be like, okay, you have a checkup, they know where they stand, then they can work on it, and then they can come back and get another feedback and see, like, is it working what I'm doing, right?
Exactly.
It's like to have the confirmation that the exercise I've been doing or whatever I've done is actually helping and it's not making it worse. And how often do you have, or see, like, because you can also have a too tensed pelvic floor, right?
Yeah.
Do you have people like that overdid it, or that it like home, you have, like you showed me earlier, like the devices you have for people to do like little apps and things.
Yeah. So there is quite a few
other
things
direction
like that. Well, but usually not with Some from doing exercises, but then I guess we have to see when you exercise, you might be doing 3 sets of 10 is the classic. You might be doing a bit more than that. That's not that much in comparison to the whole day. So usually when people come with an overactive pelvic floor, it's not just because they've done too much exercise. It's usually because they got into a habit of gripping their pelvic floor muscles. And not letting go, because some are probably scared that the pelvic organs drop. I mean, after birth, some women have that feeling like sort of everything moves down too much and they start holding on to that. Some women start leaking with coughing, sneezing, even just standing up from a chair or whatever it might be. Of course, they don't want that to happen. So people might start hanging on to their pelvic floor. And that usually leads to an overly tight pelvic floor that sometimes gets sore, sometimes just dysfunctional, because you might not actually have pain. But when people sit here and tell me, well, I leak, so I think I've got a weak pelvic floor, then they also tell me, but I have issues going to the toilet. I really have to strain. It's really hard to move my bowel. It's when I wee, it's I can't get a good stream. I feel I incompletely empty my bladder. I sort of feel like, well, I sort of get an idea. You might not actually have a weak pelvic floor. You probably have an overly tight pelvic floor that's not doing its job properly anymore. So you can have pain. You don't have to have pain. That's why a pelvic floor check is actually a good idea, because you never know what to find. And some people are really surprised that they actually there might be weakness, but that's not their problem. It could be their predominant problem is they have to start letting go of that tight pelvic floor so it can actually do its job again.
Yeah, that's good to know. And it's like, obviously straight after birth, it's more on the weak side, but then later on, or I've seen it more in younger girls too, that had like issues with leaking during their teenage years and then started cripping, and then wanted to be pregnant or became pregnant and had even more issues because they were already in a dysfunction before even getting pregnant. And then it just spirals out.
You find all sorts of things. I'm sometimes still surprised. I had a lady, third birth. She had never had issues, but she felt she had a pelvic organ prolapse. And I saw her, I think 5 or 6 weeks after birth. You wouldn't expect an overactive pelvic floor then, but she did have a really overactive pelvic floor. So and that's only, I think it was about 6 weeks after birth.
Oh wow! Okay,
so wouldn't expect that, but you can, because she was just gripping onto the muscles like hell because she was so scared something would fall out. Nothing will fall out. Just a side note, because you hear that, it won't. It can just drop down and feel really uncomfortable. That feeling is subjective. So some women actually have, like what I would still feel like a pretty normal anatomy and really significant feeling of dropping. And some women have significant dropping, but not much of a feeling of that. So again, you don't know before you assess someone what you will find.
What you probably find, But the good thing is you also, if people do have some form of prolapse, you also can figure that out, obviously, in your checkups you do. And then you also can counsel them on pessaries, right?
Pessaries.
Pessaries, but it's just also not very known, right? So a lot of people think like if something comes down, they have to get surgery, which might cause them anxiety, or they think like, oh my gosh, there's nothing I can do about it. So what are the conservative ways of dealing if something came down, if something is descending?
So pessaries are basically little devices. I show one. Hopefully I'm not scaring anyone with it. So for example, like a ring pessary, they are silicone devices that are inserted into the vagina to support the organs, but also to help taking some pressure off the pelvic floor. Because again, if someone feels they have to grip with their pelvic floors all the time, it can actually feel so good. to get the tissue a bit more supported, and they can let go. So yes, they sit in the vagina. You don't feel them. It's like a tampon, and it's a bit like if we compare it to a brace. After you had a knee injury, or if you've got a shoulder that's, I don't know, even if it's a bit of dodgy shoulder that starts playing up when you do some sport, people put some kinesio tape on it, or get a brace for their knee, or they do also. That's fine. That's very accepted to do that. That's basically like a brace for your vagina. So so it holds everything in a better position, so it doesn't, when you do high impact, for example. So say if someone's done their rehab and they're really keen to get back to high impact sport after 3 months, and that's very early. Now, there are some women who will be able to do that, not very many though, because often the tissue is very soft still. The pelvic floor might be really good, but fatigues pretty quickly, and it takes time. And so for those women, those pessaries can be real game changers because they support everything. So you're safe to do your exercise, even to do your high impact exercise, without risking to get a pelvic organ prolapse.
Yeah. But I mean, the trick is still like with any brace as well, like the same with that you still learn in that time while you're using it how to properly engage and let go, right? So you still do your pelvic floor exercises and learn how to do it correctly. So it supports it, it's not just a fix to put that thing in.
Well, no, but this is not doing anything to the muscle as such.
Yeah.
It supports your connective tissues, basically.
Yeah.
So your fascia, your ligaments, that we don't have influence on those structures with exercise. Yeah. So I get asked a lot. So am my structures not getting lazy by using a pessary? And the answer is no. It's not like we actually do have influence on those tissues by doing exercises. After birth, it's time. So as time goes on, there is usually tightening of the connective tissue and the ligaments. But then if we think, if everything sort of hangs down a little bit more and gets tight in that lower position, you probably don't get as good an outcome as you would if you had, if it is a dropping, if you had a pessary in and, you do your exercises, your pelvic floor won't get lazy because it's actually not sitting in the pelvic floor, it's above the pelvic floor. So your organs are sort of kept up. Your pelvic floor can still do its job. You can do your exercises. And since you can do your running, and of course, when you do running or other high impact exercises, your pelvic floor will be strengthened from doing those things as well, because it works with the rest of the muscles. It's a functional thing. So I don't think this is, we should see it as a brace that you depend on, that you, that you need to wean yourself off. Now, some women are keen to only have it while they need it. And then there's often a time where you can say, all right, I don't need it anymore. There's also women who choose to still for high impact, even if I say, no, actually you're fine, I can't feel any problem. And they still say, well, I'd rather have my pessary in, so I know I'm good. And it's probably for the head as well. So it's a choice. And I don't see how that would be a disadvantage for anything. But it's a bit different, I guess, to a knee, where you would think, oh, well, if I sort of stabilize it from the outside, do then my muscles and structures get used to this and don't do that job anymore? It's a little bit different here.
Oh, that's good to know. Yeah, that's like because it sits above, but
it does.
But in general, I mean, it's still advisable if after giving birth, or if you have any floor issues, even if you have a pessary, to still do your pelvic floor exercises and not just to support it from extra. To not just say like, I'm just using this, because like people always look for the quick fix and not doing the work themselves a lot of times. So that's why I'm saying it's just like, it's not just get that thing and then you're fine, just go ahead. You should still, like, after giving birth, it would still be really good to do a pelvic floor rehabilitation program for a couple of weeks to really learn to reconnect.
Absolutely.
And then if you still have issues, then it's good to like maybe get a pessary and like get that extra support.
it's an option. It used to be like, oh, that's for old people. That's, just for it's, this has changed. So I feel it's probably not changed so much in Germany. I'm not sure. I mean, I can't compare before and after, anything like that. I've been away for too long, but in Australia, while I was there, this had changed tremendously. So it was the same for old ladies, it's for ladies who can't have surgery or something like that. It was definitely not a consideration for active women. And that has, since it got into physio hands, I think it was in 2009 or 10, this has completely changed. So if you Google pastries in Australia, there is a lot. So it's now something that younger moms often use to get back to sport as a preventative thing. It's not like everyone needs to brace or to use a pessary. So, and it's even postnatally, it's not like everyone needs it, but it can be a really good tool. And it's something that's really easy to use. It's not without risks, like everything in life. This has risks as well. So of course, but a tampon too. I mean, we don't think too much about, while we have our periods, to put a tampon in. This also has a risk for infection. So we have to make sure, we keep everything clean. We do still have to get our doctor's checkups every year to make sure. But young women are pretty good in managing a pessary themselves. So it's quite easy to teach women to put it in themselves, to take it out themselves, to wash it properly. So if it's only used for exercises, for example, I think the risk for infections or pressure sores inside the vagina, it's very low.
Yeah, and I think it's also like reminds you of like more and more women use the period cups, for example. So it's really nothing else than like inserting that as well. So women
much easier.
A lot of women are used to inserting stuff into their vagina these days.
I think if you can do a cup, this will be a walk in the park.
You can do this. Yeah, exactly. So it's like, that's really cool. That's really good to know. And also, where are you located? So if people would like to see you or would like to book a pelvic floor checkup with you, how would they do that?
So I'm south of about 60 kilometers south of Stuttgart, in Empfingen, which is a really little town, but it's right next to the A81, the Autobahn. So it's quite easy to access. Yes. So it's on my website as well.
Okay. Can they book via your website or message you?
No, I don't have a booking system yet. So people can email me or ring me. So all the details are on my website. Becken, that's hard to say.
I can put it on there.
Yeah, it's probably easier.
Later. Yes.
Exactly. So it's everything, where the clinic is and phone number and email addresses. It's all on the website.
It's all on the website. That's awesome. Yeah. And it's like, I guess, private insurance would cover it, while public insurance, like German public insurance, won't. But I think it's something that's really worth to, like, if you have any issues or if you don't feel secure, if you just want that reinsurance, I think it's something that's definitely worth it to pay for and be like, okay, I'm doing this for myself, because it's a long-term thing we have to see, right? So what we can do now, or once you had your baby, to prevent further damage as you go along, or as you go to menopause. So you can save yourself a lot of trouble if you actually get checked out properly now, or straight or soon, or in the first year. Like, how soon after having a baby would you recommend doing a pelvic floor, or what would be a good time? Because you also mentioned before, like, if you're breastfeeding, it's still like softer, for example. So when would be a good time, or only if they have issues? Like, what would you recommend?
Well, it really depends. So between 6 to 8 weeks after birth is a time where it could make sense. So that's the earliest. Now, if women are keen to go back to exercise, they already know, I want to go back to running, I want to get back to CrossFit, or even just going to the gym, they probably want to make sure they are doing the correct exercises to get a good rehabilitation in a timely manner, because you can actually keep going for years. And and sort of not get there. So yes, so as soon as 6 to 8 weeks after birth. So because we do, the earlier you do your exercise as well, the better. It's never too late. So even if you're 15 years postnatal, it's not like, oh well, we really missed that one. You can at any point starting proper exercises, or doing rehabilitation. And I just said before, we're not just a pelvic floor. This is also about abdominal wall. So about deep abdominal muscles, but also the supervision muscles, which you know all about. So they often become very weak. So we have to see the whole person. But pelvic floor is an important part of it. So it's as soon as 6 to 8 weeks, but at any point, it's possible to do those checkups and to get on the track of recovery.
That's true. Like I think my oldest client for pelvic floor issues, or like who came to one of my classes, was 74 or something, and she really stopped going to the bathroom at night. So I was like, for her, it was like a huge success too.
That's amazing. That's actually
so it's like she even came with her daughter who had already had kids, obviously, as well. So they were like 70 and 50 or something. I don't know, or a little younger.
My oldest client
they came together.
96, I think. So
wow.
It's never too late, really.
It's never too late. And it's like, if it bothers you, go and get help, right? Like, don't wait.
No, exactly. And yes, with the insurances, so private health insurance, they pay for it, usually completely. So I'm a Heilpraktiker, so I did some additional training. So you don't need a script from a doctor. You can just come as well, which makes it a bit easy. If you do have incontinence and you sort of, it takes quite a bit of bravery to go and seek help, because it's an embarrassing taboo thing. And so if they call me and then I tell them, no, you have to see a doctor to get a script, it's often. So I decided to make it a bit easier for people, because in Germany, you actually, as a physiotherapist, people need to bring a script. You can't see someone off the street. So there's no first contact, but I can do that now. So I'm glad I can offer for people to come straight to see me. I'm not sure about other insurances. I do know in Germany, it's the private health insurance that pays for it, and the additional private insurance for Heilpraktiker. That covers at least part, I think 80%. Yeah. So but on the bright side, even though it is private, you don't come like you would to a normal physio. Like, you come for 6 times and you do this twice a week for 3 or 4 weeks. You come once and then you usually know what's going on, and you might come again to get checked or, to get new exercises. So, but that usually there is more time in between appointments. So it would make more sense then, if you do want to have more supervised exercise, to go to a class. We just talked about that before, to do it more in a group, to come to weekly group exercises for pelvic floor, and then get checked again after 2 or 3 months and see if that makes a difference. Yeah,
that's really good. And that's a good thing too, because it's really successful. Like, research shows that the pelvic floor classes are really really good, and that you can improve a lot if you do the exercises and you learn how to do it, and then keep going with it. That's awesome. Okay, thank you very much for talking to us today. It was lovely to have you on my podcast.
You're welcome. Thanks for inviting me.
Yes, I'm looking forward to working together in the future with you.
For sure.
All right, and then talk to you soon.
Bye, Dory.